All right, this video is about how to use your mpgun in gun mode. So your device is all set up. You have your syringe, it's correctly attached. You've looked to make sure your tube is going through that door number 2 appropriately. It's all the way in there in that groove. You have your needle attached. It's nice and snug and you're ready to go. So the first step is going to be to turn on your device by pushing the red button. When you do that, you'll see that this black piece goes slowly all the way to the end of your syringe. It takes a few minutes. After you turn the device on and you see the LCD screen where it says, please select your operation, that's when you want to choose gun on the back of the device. Like this. So gun mode has 3 key parameters. There's press, there's depth, and there is frequency. This essentially stands for pressure, depth, and frequency. You can change the parameters by pushing on the parameter of choice. For instance, press, push that button, and then use the up and down buttons here to increase or decrease your pressure. Same thing with depth, same thing with frequency. Hot tip, if you hold the plus and minus buttons down, it'll respond faster. So what do these parameters mean? So press is the pressure the device is putting on the back of the syringe. So that's essentially how much this is pressing right here. It's similar to the pressure your thumb would put on the back of a syringe if you were doing the injections yourself. Press ranges from 0 to 100%. Depth is how deep the needles are injecting into the skin. And the depth here is from 0.5 to 10 mLs. And then finally, frequency is strokes per minute. Frequency ranges from 0 to 700 in gun mode. You have the option of a manual mode versus an automatic mode. Manual mode is any time your frequency is 0. That basically means that you have to push on this trigger each time you want to inject. That's manual mode. The automatic mode is any time your frequency is anything above 0. Now in automatic mode, all you do is you hold the trigger down and it will automatically fire at a specific speed. That makes sense, right? Now in manual mode, each time you pull the trigger and you engage the needle, the fluid is released into the skin. The longer you hold down the trigger, the longer the needle stays in the skin and the more fluid comes out. In automatic mode, which again is anything where frequency is above 0, you simply push and hold the trigger. You do not want to continuously press and release the trigger in automatic mode, as this can cause the device to malfunction. That's not what you want. So automatic mode is like cruise control for your car. You push it and you cruise. You do not keep pushing the brake and the gas along the way, right? Let's talk about the volume. The volume that is infused per injection point is not something that you can set directly. The volume depends on the pressure applied to the syringe, so the press, and the time that the needle spins in the skin. And that is controlled by either how long you hold the trigger, again in manual mode, or how fast you have the frequency set in automatic mode. All right, so some general rules. General rules. If you're using a deeper depth, you want to use a slower frequency. If you want a higher volume injected into each point, then you'll wish to use a lower frequency. Or you want to hold that trigger for longer. If you're using a higher frequency, you'll want to move more slowly across the skin to avoid scratching the skin. And you want to keep the device essentially perpendicular to the skin when you're injecting. Change your needle kit when you change body areas to keep the needle sharp and reduce the pain. So for example, if you're doing a scalp on a patient and also doing her face, you want to change the needles in between those in most cases. It is not necessary to change the needle kits if you're just doing a small area of the scalp and a small area of the face. It's really about how many injections you can get out of that needle before eventually it becomes a little bit more dull. Caution, red flags, red flags. When you are out of fluid in your syringe, you will hear a single beep. Do not ignore that beep. You must then adjust your press to 0 at this point to avoid making your device very angry. If you don't change your press to 0, you will get error messages, you'll have to restart the whole thing, and you will not be happy about it. So listen to the beep, pay attention, and then just change your zero to press, and you can continue to needle, but you just won't be injecting fluid at that point. Make sense? We'll talk about pin mode in the next video.